Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that's helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our expert team, Dr. Paul Hrkal, Melinda, Krynen, and myself, Dr. Cameron Marshall, who are here to share insights, empathy, and a clear path forward. In order to protect the privacy of our members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews to see if it's right for you. Whether you're looking for answers, hope, or just a little encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
I'm on Ashwagandha for almost 10 weeks now because my sleep rhythm is pretty problematic. It goes a bit on and off. Some nights are good, but most of the nights are pretty bad. So I started with that. We had contact in the messages under the module about it. I'm taking 300 milligram at mealtime. And I know it takes a long time to get the sleep regulated. So I'm 10 weeks taking it and it's still irregular. So that's my question. So do I have to higher the dose or do I take it on not the right time? I do it at mealtime now, or what can I do with this?
Yeah, I mean, these are all good questions. And I mean, sleep is one of the major factors that so many people deal with. And it can be pretty challenging to address and treatment resistant in some cases. So, a couple things. Number one, to answer your question directly, ashwagandha has a number of beneficial effects on sleep, specifically helping to lower excessive levels of cortisol. It also has some evidence to show that it decreases anxiety because it has a calming effect. However, if those two issues are not the reason why you can't sleep, then maybe ashwagandha is not the right herb for you. But before you move on past it, I think the literature shows that anywhere between 300 and 600 milligrams is what the evidence-based dose is. And any herb is best taken away from food. So at least maybe 2 hours after. So if you're taking it after you want to take it for sleep, a good suggestion might be to take it, an hour before bed and 2 hours after eating dinner. So I think that would be a better absorption. And then maybe you could go up to the higher levels of the evidence-based dose range. But obviously trying to figure out why your sleep is problematic. If you've done the sleep hygiene, so you've cut out all screens and you've focused on doing mindfulness and deep breathing and those progressive muscle relaxation like was mentioned earlier. If you've done all those things and then also added in some physical exercise during the day and natural light exposure in the morning because that sets your whole circadian pattern up.
I've done all those.
You've done all that.
I'm pretty committed. So I've done all these things. I go outside,
Okay.
I do all the mindfulness and other the breathing stuff. My cortisol was sub high, but that's 10 weeks ago. So that's why I started the ashwagandha. So I do all the stuff. The only other thing is that my hormones are low, the estrogens. My cycle is a bit irregular. It's not off. It's just there's more weeks in between. And the family doctor said you're just in a menopause. I'm 47, and so that's I don't know. You can also take hormones because with menopause, women are also getting sleep difficulties.
Yes.
I'm not so keen on taking hormones, so that's
Yeah.
the thing.
Yeah, I'm glad you brought this up. If you don't mind me asking, do you have trouble staying asleep or falling asleep?
Falling asleep is a problem, and most of the time I wake up around 3 or 4 at night, and I'm tired when I have to go out, like 8 o'clock. I'm tired, but that's where my day should start.
Right. Okay. And so, when you wake up in the middle of the night, what wakes you up? Is your mind racing? Do you have to urinate and you can't get back to bed? Are you hot? Is there a night sweat? What's happening?
Mostly it is when I fall asleep, I sleep very deep, and then at 3 or 4 I wake up, mostly for toilet. Or I don't know, the dreams are too strange, and I wake up because of that.
Okay. So there's vivid dreams. Is there some specific things that are reoccurring with your dreams?
Uh, I know and I don't really know. I don't remember all this stuff,
Mm.
but
Well, I guess the reason I'm asking is that there's a number of factors that can be contributing to poor sleep. So, one of them is elevated levels of cortisol. Uh, Maybe we talked about changing the dose a little bit. So that's one aspect of the ashwagandha. There's a number of other ingredients that help calm the brain and support lower cortisol levels. I can just share with you some of the evidence behind a couple of my other commonly used ones in my practice. One of them is called phosphatidylserine. Phosphatidylserine. I can put the name in the chat in a moment. There's some evidence to show that it helps lower cortisol spikes overnight. It is a type of fat, so it's a fatty acid, and it actually has some brain beneficial effects as well because of how we know how important fat is for brain function. So that is another substance. There's another one called magnolia that has, and then there's a combination of a number of herbs called Relora, and Relora is a patented combo. And again, it has complementary cortisol lowering effects. Secondly, we talk about in the Concussion Fix course about melatonin and the importance of that with sleep initiation specifically. Have you tried that?
I haven't tried that one. Melatonin.
Yeah, melatonin. So go back to the supplement section. I've talked about it a number of times. We even had, I think I've done a number of extra live modules on sleep. So I talk about melatonin in more detail. Melatonin is secreted by our brain through the pineal gland, which is our circadian pattern control, hormone control center, and it is very responsive to the light that we get during the day, and then that subsequently and reflexively produces melatonin at night. So sometimes after a concussion, the pineal gland doesn't function as well with the secretion of melatonin, and melatonin has lots of evidence for actually use after a concussion because of its brain antioxidant effects. So taking that an hour before you go to bed helps kind of set the circadian pattern up. And then the last thing I'll say, so again, we have cortisol, melatonin. Magnesium is really helpful when you take it before bed. We've talked about this in the course as well. Sometimes magnesium glycinate, the amino acid glycine, is really helpful because it has a calming effect. And then there's a type of magnesium I talk about in the course called magnesium L-threonate. It is the brain-specific type of magnesium, and some of my patients say that really is helpful for falling asleep. So there's some evidence on getting into the central nervous system better. But magnesium, with majority of what you take before bed, like in the evening, can sometimes patients will say to me that they get a much deeper and more restful sleep. And then finally, the hormones. So I know a lot of people are hesitant about hormones. There's a lot of, I would say, conflicting and even misinformation about hormone and hormone replacement therapy. If you try all these different things, then I think hormone replacement therapy is an option that I think is safe in the short term for people to use to help restore a lot of the dysfunction that happens, not just after post concussions, but also the changes in hormonal cycles that happen in the perimenopause and premenopausal time. there's no supplements. There's no diet that can make up for the lack of estrogen and particularly progesterone, actually, which is a very calming hormone. So I'd maybe consider that if you've put into place all the other things that I've just shared.
Mm-hmm. And then, the thought of, when you haven't been sleeping for so long, there's got to be a bit of underlying stress to it. So it can always just be a bit of a self-assessment or question to yourself, hey, am I really feeling these effects? Am I stressing about it? Because it always, flares things up more. And I always share with people, even just the self-talk around sleep or how you're looking at sleep can be helpful when you're struggling with sleep. So for example, even beyond sort of the mindfulness and the work that you're doing with some of the mindfulness exercises, thinking about, okay, so I'm going to make sure I'm in bed by 10 o'clock, but I'm stressing for 2 hours before I go to bed, knowing that I'm going to have trouble falling asleep. And so just kind of asking yourself, does that happen for you? And if it does, seeing if you can invite sort of a shift in mindset where it's like, I still go to bed at 10 o'clock. If I fall asleep, great. If I don't fall asleep, that's fine. But what I'm going to do when I lie in bed at 10 o'clock is think about or do a few things that can support a restful state. So for example, playing a mindfulness track or meditation track, playing an audiobook that is calming. The sound of it is calming, or maybe a sleep story. I know those adult sleep stories are actually really popular right now. Things like this can just support our nervous system to say, hey, even if I don't fall asleep right now, I'm also not stressed about falling asleep. And that makes a big difference as far as when we're going to fall asleep, how our body is supported when we do fall asleep. So you can think about whether there's any sort of subtleties going on underneath the surface around, am I stressed about not falling asleep when I get to bed? Same thing when you wake up around 3 o'clock is, are you stressed about the fact that you're awake? Are you worried about it, right? Am I going to be able to function tomorrow? I have all these things to do. Or is this bad for my health? Or am I going to get another setback in my concussion? These are really common thoughts that can happen when you're struggling with sleep. I'm kind of putting words in your mouth, so I'm not sure if that's happening for you. But generally speaking, this does happen, right? We're up in the middle of the night, especially if it's happening every night. We might really feel distressed about this. So really seeing if you can invite that mindset shift to say, oh, okay, I'm up again. How can I promote a restful state? Can I make, it feel really cozy in bed, extra pillows or a nice scent in the room, something that helps support a restful state, even if you're not sleeping. So that goes a long way as far as your nervous system and just supporting your body to feel restful, even if you're not sleeping at that time. So hopefully that might be helpful too.
Yeah, I when I'm really stressed at night, I always have to think about your exercise. This is a moment of suffering, and then I'm doing that one. And the funny thing is that the body reacts on it now because I've done it so often. So yeah, I'm thinking a lot about the mindfulness stuff you offer. So
yeah, that line's from one of the self-compassion practices, right?
yeah.
This is a moment of suffering. Suffering is a part of life. Can I be kind and gentle to myself in this moment of suffering?
Yeah, that sounds really helpful, but it always makes me smile as well because it's funny. It's just
It is funny, yeah.
It's not, but it's a moment of suffering. So
Even just as you said it there, right? Changing the tone of how you say it in like a funny voice or a character voice. These things can actually brighten our mood and like actually relax our nervous system and calm our nervous system down. So sometimes even just, saying these things in funny voices to ourselves can really just, rest the body and help us just kind of, okay, this isn't going the way I planned. It is a moment of suffering, but maybe if I add a little bit of humor, I can also relax a bit more.
Yeah, thanks a lot.
Thanks for sharing.
All right, next up we have.
Hello, I'm excuse me, I'm calling from the UK, and I'm 73 years old. I got my concussion and a whiplash injury about 6 weeks ago, and I've been following the Concussion Fix and sort of getting along okay. However, just over 2 years ago, I was diagnosed with papillary thyroid cancer, and have the whole of my thyroid gland removed. And then I had to have radioactive iodine treatment. And that was that. And I carried on. Following year, about 9 months later, I had a recurrence in the thyroid bed. So I had more surgery, more thyroid radioactive treatment. So I don't know about in the States, but in the UK, one of the treatments is to overdose you with levothyroxine to stop the cancer. Anyway, I've reduced it down with my doctor, so I'm on only on 75. It's micrograms, isn't it? Not milligrams now. But the problem is, which I didn't realise, of course, is that some of the symptoms are very similar, i.e. the digestive symptoms and the tiredness. So separating what the concussion is doing to me and the levothyroxine is difficult.
Maybe I can make a comment on that, if you don't mind, just to kind of, just comment on, just since we started talking about thyroid earlier, how does it interplay with concussion and post-concussion issues? So having thyroid cancer, we've had lots of people that have gone through the program that are on thyroid replacement therapy, and also because they might have had thyroid cancer in the past. When you've had thyroid cancer, again, like you said, it's removed and then there's radioactive ablation, and you basically don't have a thyroid to produce thyroid hormone anymore, so it has to be replaced. Now, the good news is that you can replace it and continue to have a very highly functional life and highly functional, a very still adequate levels of thyroid to support your cell metabolism, even though your own thyroid is not producing it. And that's where the thyroid replacement comes in. So levothyroxine, or Synthroid here in North America, is the standard of care. And that's the precursor form of thyroid hormone called T4. The brain interprets the levels of T4 and it produces TSH based on those levels. So if you have adequate levels of T4 because you're medicated and you've found the right dose to get the TSH into normal range. Now, here's where it starts interfacing with post-concussion issues. Some people, after they have this thyroid replacement, and they feel amazing. They feel good because they had lots of symptoms of underfunctioning thyroid before. And so for those people, it can be a big positive thing. Some people start to have thyroid replacement and realize that they still have some of the symptoms associated with low thyroid function, like fatigue, poor metabolism. You might have things like constipation, changes in your hair. The thyroid does affect lots of different things. But the point that I wanted to make is that it doesn't necessarily have to be this major limiting factor that is going to impair your concussion recovery if you find the right dose of the thyroid replacement. The final thing I'm going to tell you is that there's a combination of lab testing to assess if this is working, and there's a combination of symptoms. And so if your even though your lab testing may be in normal range, if your symptoms are still having effects of low thyroid, or what you might interpret as low thyroid symptoms, maybe that's where your endocrinologist will up the dose a little bit or decrease the dose a little bit, depending on the types of symptoms. And then lastly, they may add something called T3 in. So this is called thyroxine, and it is going to be the active thyroid hormone. Now, it is much harder to supplement or medicate with T3 because it has such a short half-life in the body. That's why doctors preferentially use the Synthroid levothyroxine as a replacement, because it's much easier to stabilize levels. So the takeaway from this story is that it should not be a limiting factor in your recovery if you've found a balance here.
Okay, thank you. I mean, I'm someone who's always researching everything, and I've been into healthy eating. I've had 2 whole food shops for 45 years. Um, and I'm one of these people who Melinda talked about, who, in inverted commas, knows everything. For example, I've trained as a mindfulness teacher. I've done all the courses. The trouble is, I don't always apply it to myself. It's much easier to apply it to everybody else. So I'm going through this whole course with just delight to be able to sit down and listen and to sit on my hands, if you like, and sit on my mind to stop it jumping about, to hear what I need to hear. So I'm really grateful for that. Thank you. One other thing, I've been doing intermittent fasting for, about 10 years, I think. Should I stop? Because I feel, I don't feel great generally. And looking at the foods and the advice that you give about eating, little and often sort of thing. So, I'm open to do whatever. So one of my questions is, should I just stop doing that for a while? And the other thing, I found something so helpful regards the constipation I was getting from the thyroxine, which is to take kefir every morning on an empty stomach, which was milk, whole milk, organic kefir. But I've always had a mucus issue, and I just sense that, the milk is just sort of niggling away at me. So I could take it in forms of water kefir, or maybe use a plant milk. What would be a suggestion?
Yeah, so I mean, you're talking about a couple things here. The intermittent fasting first is an evidence-based way of eating that's going to be restricting your feeding window to a shorter period of time. And the idea is to try to allow the body to get into a fasted state for a longer period of time, not just overnight. And you're going to have some metabolic benefits. Now, we've talked about this at length during the course because some people, in fact, I would say it is fairly common for people that are recovering from PCS to be more sensitive to blood sugar fluctuations that can occur if you miss a meal or fast longer. And so if you have tried intermittent fasting and you've really given it a good go and you don't feel good while you're doing it, then you may have some of the other what we might call dysautonomic or hypoglycemic, which means blood sugar imbalances. And the autonomic nervous system does play a role in this too, because it also is very sensitive to some of these fluctuations. You might be better served by following a very, very anti-inflammatory and high nutrient dense diet like described in the Concussion Fix program, and just gauging how you're going to feel during that. And that does include avoiding gluten. And this is a good dovetail into your second question, which is about dairy products. It is a really common question, and when we do this re-record coming up in this next year, I'm going to make sure that I'm going to be very clear on this, because the only food that we talk about as being something that you should avoid as part of the Concussion Fix program is gluten and foods that contain gluten. So that's obviously wheat, but it's not restricted only to wheat. Things like spelt, for example, have lower levels of gluten. And that's the only one really that we've found that the evidence is compelling enough to really give it a trial. Everything else is subjective to the person. So if you've have this feeling or just past experience based on what you've eaten and then the reaction you get after, that maybe dairy products or another type of food is causing a negative reaction, an allergic reaction, a gut reaction, an inflammatory reaction. It could be a whole host of different things. It doesn't just have to be gut related. Then maybe you should avoid that food. But that's very personalized. That's not something that we're going to say everybody avoid the top 5 food allergens. That means people would be eating no gluten, no dairy, no eggs, no soy products, no corn, and then there's probably a couple other ones. But everything else, that's too restrictive, and we want to make this program approachable and achievable right away. We don't want to overwhelm people with too many different restrictions. We actually want to add good things in and really eliminate sugars, alcohol, highly processed foods, or what are called ultra processed foods, and gluten. So hopefully that gives you some context as you're going through the program, where dairy, if you suspect it, avoid it for a month, just like gluten, and then see if you notice if that mucus goes away. If it does, that's a pretty good sign that you're probably sensitive to it in some way and it's causing an adverse reaction, and maybe it could impact your recovery.
Okay, thank you. Got it. And the last thing, really quick. The other day I remembered that when I was 7 years old, which was 66 years ago, in those days when you rode horses, there was no helmets. And I'd never rode a horse. And we went on a holiday and I rode a horse. And my horse decided to gallop. And I fell off and got concussion. And I can remember my mother having to wake me up, or that she was told to wake me up every hour or something during the night, which I think was an old way of checking that you hadn't died or something from had brain injuries. And I just wondered, is there anything about having more than one concussion in your lifetime? You know, how many concussions can you have? You know,
I think what you're trying to say is that if you have a history of concussions, is that somehow predisposing you to having more concussions or to having more symptoms of concussions? The answer, resoundingly, and Dr. Cam would agree with me, he's not here right now, he has answered this question before. His answer is no. So, you know, what we don't fully know is the cumulative effect of multiple concussions over a period of lifetime. It doesn't seem like that impacts the chance of getting another concussion or even getting post-concussion syndrome based on the evidence. However, just based on my clinical experience, I think people that have sustained multiple concussions that they haven't fully resolved, and that's the big thing, is that if you have unresolved symptoms, or maybe, you know, you're back to 80% and you're like, okay, it's good enough, but I still have a lot of neck pain and I still get dizzy when I get on boats or when I drive. Well, that's not fully resolved. And so if you sustain another concussion, that I think has an additive effect, and that is more in the realm of post-concussion or persistent concussion symptoms that haven't been fully resolved. But just because you got a concussion horse riding 40 years ago doesn't mean that you're now predisposed to dementia or more concussions now if that has resolved.
okay, thank you very much for taking my question. Thank you.
You're welcome. Good questions. Thank you for asking.
That was that piece I was thinking of as well, Dr. Paul, is, you know, Dr. Cam's constantly kind of driving that home, that idea of like the cumulative effect. If you haven't recovered between concussions, that's something to look out for, not if you've had a concussion at other times in your life and recovered. So I'm glad you mentioned that.
100%. Yes, I agree.
Right, next up, we have.
Hi everyone, long time no speak. So I've been doing really well, and in the last few weeks, however, I have started to be more easily triggered with my eye symptoms. It's reminding me of how, because I'm not currently working, but it's reminding me of how it was when I was working, and there was a lot of stress happening last year in the midst of when my post-concussion symptoms were the worst.
Mm-hmm.
It's not nearly as bad, thank God. But it's stored. I'm more easily triggered, I noticed. The one common denominator that I realized had happened over the last few weeks is I've been going to a chiropractor who has been doing a lot of amazing muscular work, because I had a lot of tension in different parts of my body, and that's been working really well. However, the reason I went to the chiropractor is because my hip was bothering me and my shoulder, as I've been running more to ensure I'm doing the cardio that's recommended, you know, at the specific BPM. And so the only thing that I haven't been doing over the last few weeks is the cardio. And so what I'm of course I don't know for sure, but I'd like to hear what you guys think. You know, that's the one thing that I haven't been doing. And I'm going to vision therapy, which seems to be helping tremendously. But again, I'm more easily triggered. So what I'm thinking might be happening is that because I have this lack of cardio in recent weeks, it's sort of not balancing my nervous system as it was. Perhaps it has something to do with blood flow. I don't know. But I just wonder if you had any thoughts or if that sounds right, because I'm working my way back into cardio this week. Now that my hip is feeling better, it was super tight. And like I mentioned, I got some work done on it. So it's feeling like I'm slowly working myself back into it. Yeah. Do you think that sounds like a decent hypothesis, or any thoughts on that?
Yeah, so just so I understand it correctly here, you're saying that because you've been getting more care for, I think you said your shoulder, right? And there was one other thing, your knee,
Well, my hip,
your
that's
hip.
what stopped me from being able to do the cardio.
Right. Yes. Okay. So because you haven't done that for a couple of weeks, you feel like you're getting more symptoms?
No, yeah. So basically, I haven't been able to do cardio for probably a little over 3 weeks.
Okay, 3 weeks. So you're thinking that that's because you're more symptomatic, that because you haven't been able to do that cardio. Have you been able to do any sort of other type of exercise during that time?
Very slowly, like doing some PT, like simple exercises related to my hip and my shoulder.
Mm.
So not working and I am actually, to be honest, someone who works out regularly, and when I don't, like I don't have like heavy anxiety, but if I don't work off my energy, I definitely see an impact there in terms of
Mhm.
anxiety when it comes to stress.
Yeah, I mean that's an important consideration, and it sounds like you're just being really mindful about it. That you're able to make those connections. I mean, 2 to 3 weeks is a pretty short period of time, but again, I think if you're a sensitive person that really relies on that movement, could it increase symptoms? Possibly. One of the things that comes to mind is, okay, so if you have, and this goes for anybody listening, if that there's any sort of physical limitation that you have, for example, hips or a shoulder, is there a different type of movement that you could do that maybe isn't in line with what you were trying to do before? Maybe with Dr. Cam's recommendations, definitely trying to increase some of that steady state cardio, getting up to some of those thresholds. If for whatever reason you're sidetracked, I would really encourage everyone, okay, find another option to try to do that cardio. If you can't do the cardio at all, because hip affects lots of different things in terms of movement, then can you do some resistance training to still get some of the adaptive effects of exercise? So if you have two things going on, both shoulder and hip, there's quite a bit of limitation there. So maybe can we do something like a rowing machine if possible? Again, there are lots of variables on whether you might have access to this, but maybe I encourage you while you're trying to get this rehabilitation happening. So do those rehab exercises, but then still try to get your heart rate up in any way possible, even if we're going to try to do it in a little bit of a resistance exercise way.
Was there a sense of, just a question, as maybe this was answered in a previous question you had, around autonomic dysregulation, where Dr. Cam had recommended only steady state cardio, or was that okay?
Well, I guess I don't know too much more about this particular person's case in terms of if there's autonomic dysfunction. Can you comment on, again, your top symptoms right now?
So it's more that my main symptom throughout this whole time has been eye pressure, like eye pressure headaches. And so what I noticed is, like, if I'm looking at, I've come so far in terms of being able to be on screen. But what I'm noticing in this last few weeks is sometimes immediately now when I look at my phone, I will have like not a major rush, but enough of a rush to notice the eye pressure symptoms. Like that's my big, and it reminds me of how I was when my symptoms were very bad. So
I'm curious, Dr. Cam always mentions this, and unfortunately he's not here today to sort of help support. But I'm thinking about that sense of, exercise benefit is sort of warming up the muscles and helping them to relax. That's one of the key messages Dr. Cam's always saying. So I'm hearing, maybe without that, you're starting to notice some of this tension that can create, it could be the neck dysfunction or something else that's creating sort of these visual symptoms. So I think to Dr. Paul's point, seeing if there's a way to continue getting some of that exercise, even if it is, weights or resistance training, as long as you aren't experiencing that autonomic dysfunction piece, in which Dr. Cam consistently recommends steady state cardio only, which can be really restrictive if you have other injuries, because there's really only 3 options he recommends, which is the treadmill, a recumbent bike, or the rowing machine, or walking outside.
Yeah, I'm gonna talk to my visual therapist later today as well to see if she thinks there's something happening with, if it's related to like looking down at my phone. Although, like I said, it was doing so well, so it's a little bit odd. I think the other question or related question I have is, so when doing the cardio and getting my heart rate up, is that helping my autonomic nervous system? Like, is like regulated? I wanted to understand that. Or is it doing something, or is the cardio, and getting my heart rate up doing something else? I know it's probably
I
not
think
that
there's
simple.
kind of 2 different ways to answer that, Dr. Paul. Go for it if you want.
Well, I mean, okay, so I think just understanding it simplistically, one of the things in autonomic dysfunction is that you have trouble regulating blood flow. That's like at the core of what's going on. And what regulates blood flow is your autonomic nervous system. And so when you are moving your blood more because of you're moving your muscles more, you are challenging that vascular system and therefore the neurovascular system that supports the blood flow, aka your autonomic nervous system. So think of it like training and conditioning that nervous system. So when you're challenging it, you're basically challenging the threshold of, okay, these are my limits, and then all of a sudden it starts triggering symptoms. You want to continue to kind of push that. Now, if your main symptom is you're getting kind of pressure headaches, then obviously that's a big one when it comes to neck issues, and that may or may not be related to autonomic dysfunction. In my experience, it often isn't, and it's related to some kind of more structural issue. Autonomic dysfunction is really related. One of the key tests is like, can you pass the treadmill test? And have you done that?
Yes.
And have you passed it?
Yes.
Then you don't have autonomic dysfunction, most likely.
Okay, and so this was the other thing that, if you don't mind, just to kind of continue a little bit. This is something I just spoke yesterday to the chiropractor about. He basically, over the last few weeks, has done a lot of muscular work in terms of relieving tension around my neck into my shoulder, also around my hip, like down throughout. And he thinks I'm doing really great. He's noticing that, and I know this is more of a Dr. Cam question probably, but he's noticing that he wants to do some adjustments to the joints in my neck. Like C2 seems to be an issue.
Okay.
So we're planning to do that next week, but because I told him that really, like, I haven't been able to do the cardio and I want to start working on that, like, in case that's impacting me, he's like, okay, so work on that over the next week. And once you sort of get yourself back on track, that'll be less of a factor, perhaps, when we start working on the neck, so we can, like, sort of isolate, see if this is
right.
That could be the issue. So yeah, it's good to know, like you mentioned, that the eye pressure issue could be more of a structural thing, and that kind of a light bulb went off when he mentioned that in terms of the joint. So hopefully that will do something. I mean, this is just all so wild. Like, I just cannot get over this over and over. How many just wild. Sorry.
It's very complex, right? It's very complex.
So
It's like putting a
complex.
puzzle together, which was kind of our inspiration for developing this program in the first place, is that it's really tricky to navigate. And without a bit of structure, it can be hard to isolate the variables that are causing the issues. So hopefully that helps a little bit, right?
Yes,
We're hearing that there is
definitely.
an autonomic dysfunction, so that you should be able to do other forms of exercise, resistance, weights, whatever, to kind of help with blood flow, help with that outlet for anxiety, because that's a big one too, right? Anxiety is that other factor we didn't even touch on yet that can mimic symptoms of concussion. So just, keeping that in mind as well. What are your outlets? If your outlets are exercise, you don't have autonomic dysfunction. Okay, so bringing in exercise in different forms that can help support you right now. And then just kind of working on each variable and giving yourself time, right? I think it sounded like your provider was quite good, choosing one variable. Let's sit with that for a week and see how you are. Now let's think about the next variable instead of trying to do everything all at once, because that can really overwhelm your nervous system.
Mm-hmm. And if that chiro is working on your neck right now, then that is another factor that could be making symptoms worse, just again, and transiently. So again, it sounds like just based on our conversation, there isn't much autonomic dysfunction. So talk to your chiro about, okay, so if I can't do my normal cardio, then is there types of exercises I could do that is okay with my current MSK limitations, your structural limitations, but I can still get some of the benefits, because you have to be careful. Like certain types of exercises can make your neck pain, tightness maybe worse. So
Right.
that is a key question to ask. And then just remember, if they're digging around in your neck right now and starting to do some work, and maybe this needs to happen, you may actually feel a little worse before you feel better. And you might be on the right track if you're getting more symptomatic. So it could be a little bit of a silver lining that this has paused your current approach and really personalized what you need to do. And maybe you just need to work on a particular type of set of movements that's going to strengthen the weak areas of your neck. And that's where I'd be asking the chiro.
Right, exactly. Okay. I know I say this every time, and hopefully you guys aren't sick of hearing it, but I just am so grateful for this program, and all of you are just so wonderful at answering the questions and so compassionate. I just appreciate it a million times. Thank you so much.
You're so welcome.
Good morning. I wanted to ask, I unfortunately ended up in the ER recently. I had, as you both know from other things, I've had a reaction to, I'm not really sure if it is related necessarily to the accident, but I have been very sensitive with my food allergies and things. And I recently, over the past few years, developed osteoporosis. So I did Evenity shots, and then last week I had an infusion right after or right before I got my vertigo fixed. I had a Reclast. It's an infusion of the drug that's supposed to help with building your bones. And now I'm kind of having a lot of similar symptoms that have happened with regards to my concussion, where like my neck pain has been like the worst. Right now it's better, but immediately it was like the worst headache I've ever had. It felt like someone was squeezing my head, my neck. I couldn't, I got weakness in my triceps. I couldn't get myself out of bed. I tried to power through it because I knew that some of these things might be coming. It's on their list of reactions, but I'm just trying to work through some of this and try to figure out what happened, and if there's something either of you could suggest that would help me counteract. And I don't know if because I have that tendency to the headaches now, if it's hitting me harder than most people. But it could be that it's not necessarily related to the concussion, but I'm just trying to figure out if there's a way, my TSH is high. but the T4 was 1.1. I'm at 6.2 for the TSH. That was one anomaly. The leukocytes in my urine were off. I think there were a couple of other things, but it wasn't like there wasn't anything to keep me overnight. They asked me to follow up, and I'm going to do that after this call. But what I wanted to ask Dr. Hrkal and maybe you is, is there anything you can suggest? I mean, I feel pretty calm. I did try to work through it on the weekend, and I knew not to like drive myself there. I wasn't freaking out, but I know that, underlying, it's a concern.
Yeah, it's a kind of a scary reaction that you're having. It makes sense to be overwhelmed by it, right? I'm hearing you're kind of aware of your emotional state, and that, it makes sense to have this experience and have the feelings that you're feeling. I'm seeing this as like a separate, reaction to, not related to concussion. But let's see if Dr. Hrkal has any comments for you.
What was the name of the medication that you took again?
It's called Reclast. It's Reclast. It's for osteoporosis. Like close to 40% of the people that have these weird reactions, but like mine is pretty extreme. Like I'm obviously reacting a lot. And it's just frustrating because, the medical community really does not, put these things, out there. So I'm just curious if you have any ideas, like, is there a supplement that would help cleanse my system? My kidneys were fine. All the other tests that they were worried about were fine. So I'm just looking for some guidance.
So let me just tell you, the reaction that you described is actually the typical reaction people get when they take this particular infusion. This is called zoledronic acid or Reclast, and it's a very commonly used medication for osteoporosis and hypercalcemia, which is excess amount of calcium in the blood. So it kind of just pulls that into the bones. But it is, I'm going to say, common to get side effects after it, like you feel flu-like, and then there's fatigue, body aches, headaches, muscle, joint pain, all the things you described basically is the expected effect. And the magnitude of that is really personal, meaning that some people that have maybe some underlying inflammation, post-concussion is definitely one of those situations where people, in my experience with persistent concussion issues, dysautonomia, and this chronic inflammation just have an exaggerated response to a lot of side effects that are possible. And so it sounds like this is the expected side effect profile, and you just had the higher version of the stronger version of it. So I think what you're going to be told, again, I don't know, I think you should do your due diligence by seeing your primary care doc. And then, obviously you went to the ER because you felt it was severe. These are things that
the doctor made me, he said to go.
And I think that's reasonable. I would guess right now, and again, I'm not your doctor, but I would guess that this is an exaggerated level of the typical reactions you get.
Right. What I'm curious in your mind, and maybe there's not anything, but I'm just wondering, is there some kind of cleanse or, supplement that could help me purge besides water? Because I woke up the other day, I could barely lift my head, and I was just like so thirsty, so my husband brought me more water. Luckily I'm feeling better, and I'm trying to drink it anytime I can, but I'm just curious if there's any other supplement that I should consider.
Yeah, nothing that, because it's infused, it's in your bloodstream. So it's not like it was something that was exposed through your gut. There really isn't any sort of evidence-based supplement that I can think of that's specific for this. It's just really something your body has to deal with. And I think you kind of hit the nail on the head with the hydration, is that and then along with that is like the basic core nutrients that help your body function. So You want to make sure you're optimizing your minerals, electrolytes, vitamin B vitamins specifically help your liver do its job better. There's
Which one? Vitamin B?
B vitamins, like the whole B vitamin family. Then there's also a substance called glutathione that your liver normally makes to protect its own cells. And that's depleted by things like alcohol and sun and other toxic exposures. So things that will increase glutathione is adequate levels of protein. So having, let's say like something like chicken soup, which is what we always think of comfort, but it has the chicken, which is high in protein, and then it has some of the other electrolytes and even other molecules like carnosine that are present in the broth. That's so eat more lightly, eat very healthy, eat clean, continue to hydrate, try to get a good sleep. But I think this is just a passing effect of that medication.
Yeah, I mean, it seems to be going away, and like you said, that's what I've been doing. I'm just going to continue on and just do that. And I'm in your section right now, so I need to just start listening to them, and I'm trying to balance everything. I feel like I'm doing okay. I just thought you might have some ideas. I will make sure I'm taking those and look at the amounts of the B vitamins that's in my complex, and appreciate your help. And hopefully I can watch the Tai Chi today. And
well, anyways, thanks for connecting with us. I'm hopefully we can give you just some reassurance, but it sounds like you are just experiencing this. That is the normal kind of effect, or expected, I should say, and it's getting better. So
okay, thank you so much.
You're welcome.
Yeah, keep doing all you're doing.
I will. Thank you for your. I love your meditation. I listen to it every night. The body scan. That's how I go to bed. And I appreciate Melinda. I'm so glad we have that.
Yeah, sometimes just helping yourself to get grounded when things are feeling overwhelming or things are feeling too much, or you have something happen like a side effect of a medication. It can be helpful just to have some tools in your toolbox to support you. So reaching into those and staying consistent with everything you're doing, right? See if this passes.
Yep, I joined the Mindful Mandela class last night too. I loved it. So thank you.
You're welcome.
Welcome.
There is a follow-up question for you, Dr. Hrkal, in the chat. They just don't want their voice recorded. So during last week's Q&A, they asked about their mild thyroidism and the effects it could have on her recovery. TSH is 5.3 with negative TPO antibodies. Recently, I read an article read the increase of iodine deficiency in Canada, and I'm wondering if iodine could be a factor. I never eat out and very rarely add any table salt to cooking or food at home. I do, however, have eggs or fish several times per week each and a fair bit of dairy daily. Would I likely be getting enough iodine from these foods? What is the best way to test for this? I have read that there is a skin test that you can do at home to assess iodine levels, but it is not very accurate. Question for Melinda afterwards. I have recently heard of a technique called havening. Do you have any experience with this?
It's called havening. Yeah. All right. So let's talk about thyroid here for a second. So it sounds like from the TSH, that's the thyroid stimulating hormone. That is a brain hormone that's secreted by the pituitary gland to basically in response to the levels of thyroid hormone we have in our bloodstream. So when thyroid levels go down, hormone levels in the bloodstream, the TSH kind of goes up to compensate. So it does sound like this person has a slightly underactive thyroid because the TSH is elevated. Anything over 2.5, so between 1 and 2.5 is the ideal range. So anti-TPO antibodies are the autoimmune reactions, and it's negative, so that's a good sign. That means your body's not attacking the thyroid, which could be one of the reasons you could have a sluggish thyroid and elevated TSH. Iodine is one of the key minerals specifically for your thyroid for the production of thyroid hormone. It's essential for it to properly work. Now, iodine was added to the general food, to a number of different foods, primarily table salt. Again, this was done in the early 1900s to prevent something called goiter, which was, a well-known deficiency of iodine that caused the thyroid to swell. Because again, the thyroid is trying to compensate for, hey, we got to produce more thyroid hormone, so let's increase the amount of tissue making thyroid hormone. And so what happened here is that it started becoming fortified to prevent these deficiencies, because there isn't a lot of foods that have a lot of iodine in it. The main food groups are fish and crustaceans, so like shrimp and different types of fish will have some iodine in it. The best vegetarian source is going to be sea vegetables, so things like seaweed, kelp, nori, kombu. There's a whole list of these vegetables, and it's actually one of the factors that has been associated with longevity that's experienced within certain groups of people around the world. There's these things called blue zones. One of them is one of the most famous ones is on the rural parts of the islands of Japan. Okinawa is one of the famous ones, and they are famous for eating some seafood, but definitely some sea vegetables as being a key part of their diet. And that actually, as a bit of a side note, there's some evidence to show that it offsets the negative impact of soy products, because soy products can actually make your thyroid more sluggish, along with something called the cruciferous family of vegetables. So certain foods are called goitrogens, and they basically make the thyroid not as efficient and not as effective. So this was a long preamble to get everybody on the same page, but to answer your question now directly, is that iodine can be tested, and you can do a hair mineral test for iodine. There is something called a iodine skin test, where in a doctor's office they kind of paint on a bit of an iodine solution. It looks like something that is very bright, kind of like a dark orange or brown. That's the typical kind of tincture of iodine that's used as an antiseptic, same type of color. And then they basically are tracking how long it takes to be absorbed in your skin. If it disappears in a short period of time, it may indicate that you're deficient. Now, I think I don't use this test in my practice. Clearly, by the description, I'm not giving you this real big details here, but I think that is not a very accurate way of testing it necessarily. I prefer to test through hair, and that's a way of seeing if iodine is deficient in a more accurate way. It's a reflection of what's going on in the tissues. But I think in general, the last thing I'll say is that I think people have been scared into avoiding things like salt because of the heart issues associated with salt. And I think a lot of that's been majorly overblown. So we've heard of sodium, which is sodium chloride, is connected to increasing hypertension or blood pressure. And this actually only occurs in a small subset of sodium sensitive people. So it's not like everyone that's listening to this is automatically sensitive to salt. That's not the way this works. And because salt in North America, at least, has been fortified, meaning iodine's been added to table salt to prevent that whole deficiency. But now, because people are avoiding salt because of all the heart issues, they might become more deficient iodine. Iodine deficiency is one of the more common deficiencies in the world, and it actually can become problematic in things like pregnancy, conception, fertility, children, especially if they are really avoiding any sort of those foods I mentioned, including, I think, having good electrolytes, which salt is a part of, I think can be helpful for people, especially if they have lower blood pressure, if they have dysautonomia. Electrolytes can be really, really valuable. So hopefully that's given you a little bit of background and also insight about, I think a question that a lot of people are asking about their thyroid, but also specifically the mineral iodine.
Yeah, Paul, I'm glad you mentioned about sort of the dysautonomia, because I know a lot of members here have this sort of like autonomic dysfunction. And if that's combined with low blood pressure, I'm aware that sometimes salt is actually a key component of supporting that. Is that right?
Totally, yeah. And it can be part of a therapeutic approach. In fact, some of the leading researchers in the world on autonomic dysfunction and conditions like POTS and dysautonomia and orthostatic hypotension, which is low blood pressure, or orthostatic tachycardia, where your heart rate goes up. electrolytes, and again, sodium, potassium, magnesium, and chloride are all part of those, part of the electrolyte family, can play a really important role at stabilizing autonomic function. So I think that idea around salt is bad for everyone, we should avoid it, is too general. I think there's some specific people with high blood pressure that are sensitive to salt. Some people have water retention with salt. They should be more careful of it. But otherwise, the type of salt, I think, makes a big difference. Most people's salt intake, Melinda, is related to processed foods. That's where you're getting it. Like, the third ingredient in ketchup, for example, is salt. It's very high in sodium. It's also very high in sugar. This is where most people are getting, the very base level of salt. I think if you're now getting it from a sea salt source, if you're getting it from something like, let's say, Celtic sea salt, you're going to get the whole array of minerals that come along with sodium. And I think that's going to get you a lot more therapeutic benefit. And so, I think that we have to be careful of not overdoing the dangers of salt, because I think it's been way overblown.
Great. Melinda, have you ever heard of havening? They were also wondering.
Right. Yeah, I've loosely heard of it. It's not an evidence-based technique as far as I'm aware. It is similar, sounds similar, and has some similar concepts to EMDR, which is eye movement desensitization reprocessing. I had to think about that, or EMDR, which is a trauma processing therapy technique. And the general idea is to use like a neurological approach to reprocessing trauma. So in EMDR, they use eye movements as a way to sort of process traumatic experiences and remap them in your body, Havening, I don't know too much about what it's like, but it does sound quite a bit like EMDR. And the intention of it is to help support you to ground and stabilize your emotions, help support you if you're overwhelmed by a traumatic experience, and give you some sense of relief from symptoms, psychological, emotional symptoms that can occur following a traumatic experience. Of course, here we only really talk about evidence-based modalities, so that's why I'm referencing EMDR instead. I think that's kind of a good summary. I don't know if you guys at the Pain and Wellness Center, Dr. Paul, do you guys use havening or no?
No, unfortunately, I've never heard of it before, so I can't really comment on it. I mean, there's techniques that come up around the peripheries, around like slight different permutations of some of the other existing techniques. Some of the existing techniques also, they're pretty restricted with like where you can get the training, and I think that they've been monetized, and so I think some of these other providers are maybe looking to create their own little thing sometimes. And we've seen this in the chiropractic profession, for example, where something called muscle release technique, MRT, is the general version, and there's active release. But active release is you have to take the course with this one provider that has like a monopoly on it because they've restricted that name and title and they've trademarked it. So, I mean, I think your point is well found, where it's like there are similar techniques, but they may not be the exact one. But we can really speak to all the evidence-based ones and the ones that we use with our practice.
Yeah, and EMDR is a huge science-based, evidence-based technique. So if you're looking for something to try as far as trauma processing, I would recommend looking into EMDR. It looks like they have trademarked havening. I just did a quick Google after you said the question because I wasn't quite sure. But that doesn't mean it's evidence-based. It looks like there's very little literature around it. So taking a peek maybe at the EMDR, seeing if that's a good fit for you. Not that you can't try havening, but not something we can really speak to here.
Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.